Caution is the word of the hour at MedStar Mobile Healthcare in Fort Worth.
So the ambulance crews will wear this for a patient that they suspect is having a coronavirus.
As of Friday, ambulances are now stocked with specialized protective gear.
This is a highly efficient particulate mask that will filter out any aerosolized droplets.
And 911 dispatchers and medics alike are now asking patients with respiratory issues about where they've been.
Our 10 o'clock conference call this morning with the CDC was where we got that advice. By 10:28 this morning, we had already pushed that advice and a medical directive to the field staff.
Wow, that's quick.
Yeah.
Matt Zavadsky says there's no room and no time for error. As of Friday, 2 people in the U.S. had confirmed cases of coronavirus, with a total of at least 63 people being evaluated.
This is not a dissimilar response to how we handled the SARS situation several years ago, and in some cases is relatively similar to the Ebola crisis that we had by doing that additional screening question.
UT Arlington is another institution that's following the coronavirus developments very closely. A UTA spokesman told WFAA they're in touch with students who have visited or who are in China or nearby countries, gathering information on where they went and sending out protective guidelines to all students. So far, they have not identified anyone who appears to be at risk.
We have to take this seriously as a healthcare system and also as the public, because it will not take much to have what happened in China happen here.
And if it does, they will be ready. In Fort Worth, I'm Lauren Zakalik.